Hello again. Thanks for joining me. Well, the last video ended with me having uh, told that I needed additional testing and a diagnosis for my uh, prostate cancer. Apparently, according to the uh, insurance companies, you can't receive any kind of treatment if you don't get a diagnosis according to the rules, and those involve, first of all, a rectal examination, and then if that rectal examination turns positive, what's next is a biopsy of your prostate, which is extremely painful. What it entails is taking chunks of your prostate, uh, several chunks. I forget how many there were, but it was painful enough. And after I remember what after the doctor was done with the biopsy, he said to me, "This, my friend, this looks really bad." And I thought, "Well, thank you very much for that." So I left, and I just waited to see. I was going to set up the next step in my treatment. The next step involved a lot of, involved driving back and forth to the hospital. And I didn't have a reliable car, and I didn't really have that much money to be driving back and forth. So I didn't know what I was going to do. I just went home and I guess waited for me to die or for whatever the next step of the cancer was going to be. As it turned out, the next step of the cancer was already in progress, and that was I had been feeling a lot of pain in my left hip, and I had gone to a doctor, and he had told me that it was either the cancer or tendonitis. So he gave me some exercises for tendonitis, and I had been doing those exercises. But this one particular night, I suddenly got a lot of pain in my lower back. I mean, tremendous pain, unbearable, to the point that I had to go to the emergency room again. And I figured, well, I'll go to the emergency room, they'll give me something, and I'll be able to come back home and continue waiting for the next step to occur, or maybe at the ER they'll tell me what to do next. So I went to the emergency room, and they gave me something for the pain, which was, I forget what it was, but it was extremely effective, thank goodness, because it took care of my pain right away. But also they said, and now we're going to have to transfer you to a hospital where they will have to do emergency room. Emergency surgery on you. And I thought, what do you mean emergency surgery? Yes, emergency surgery. And we have to do it right now. Apparently what was going on was that the pain in my hip was due to the fact it was not really in my hip. It was in the upper part of my thigh bone, which was the cancer had moved to that part of my body, and the upper part of my thigh was crumbling with cancer, and it was going to be very soon. That thing, my thigh was going to break, and I was going to hit the floor. So they rushed me to surgery at a hospital where they could do that surgery. And then they started recovery there. The problem was that I couldn't go back to what used to be my home. In essence, I didn't have a home anymore because I didn't have anyone that would take care of me. I didn't have any money to pay for anyone to take care of me. And I didn't have money to pay for any kind of rehabilitation services. I didn't even know how I was going to be able to pay for what was being done for me at the hospital. To this day, I'm not sure. I think it was being paid through Medicaid. Maybe part of it was being paid through Medicare because I had been forced to take early retirement for the purposes of Medicare, for help, for whatever little help I was getting, going to the emergency room and to the hospital. So the question that I had now was, what's going to happen next? I don't have anyone to take care of me at what used to be my home, and I don't have any money to pay for anyone to come and take care of me. And the nurses and everyone at the hospital kept telling me, well, it's time to go home. And I'm thinking, I don't have it. I was telling them, I don't have a home anymore. I can't go back. I would just be left to my own devices, and I can't take care of myself. And my fear was that I was just going to either, be put out on the street right outside the hospital, or that I was going to be taken to where I used to live and be dumped on the grass on my lawn. And that the hospital people were going to wash their hands of everything that was going to happen to me next. And I started begging. I started begging them to please not take me back because I didn't have anyone there. The nurses at the hospital, I got to make a distinction between the nurses that were taking care of me at the hospital and the management. Their managers and the upper hospital management. The nurses were extremely nice. They tried to calm me down and tell me that they were not going to put me on the street, that they could not put me on the street by law. But the managers were not. That was not their attitude. Their attitude is, how are we going to get this guy out of here? And during the time that I was at the hospital, I was so desperate and scared. I was scared to death that I asked for them to let me talk to a chaplain. And the reason I didn't ask for a chaplain before that was because I had never, all my life, I had not only not believed in God, but if I had believed in God, I hated God. And I cursed him just about every day. I was in the clutches of the devil all my life. And I remember that the chaplain finally said, because I was telling the chaplain, I don't want to be put out on the street. And finally the chaplain just said to me, well, I guess that they're going to have to. I think he was just upset and sick and tired of listening to me whine. But then at that point, I finally just kicked him out, and every time I saw his face peek in the door, I told him to leave. So there we were. And the managers, I know that when the managers saw me, they told me to go. Sometimes I went out of my room looking for a nurse, and the managers told me to get back to my room, and I could hear them mutter about me still being there and how they were going to get rid of me. That didn't make me feel very good or very reassured. So eventually they found a place. It was essentially a nursing home where to dump me. And we can talk about that in the next video. So I'll see you guys then.